Hi, I'm Dr. Melanie Palm from Artist Skin NdYAG in San Diego, and today we're going to be demonstrating the Spectra Laser by Lutronic. It's a really versatile laser. In this instance, we've used it really successfully to treat melasma on a patient. There's always concern with using lasers on darker skin types, but this is a longer wavelength laser and it's really safe to use on darker skin types such as Hispanic skin types, Asian skin types, even light African Americans. So we're going to do a couple things. The patient has a carbon lotion on her skin at this point, so our first pass is going to be real loud with the laser as we sort of take that off. It sort of gives it almost a microdermabrasion to the base and helps with skin texture. And then I'm going to do subsequent passes. This patient already has been treated. She's just on maintenance therapy. We see her about once a month and has done fantastic. She actually had not only melasma but some pigmentation after having an IPL that caused pigmentation. So with that, we're going to get started. All right, 1, 2, 3, in between the eyebrows. I'm going to adjust this just to make it a little bit bigger, spot size-wise. There we go. So this first pass takes off the carbon lotion. This laser is attracted to sort of brown and black pigment. Turn to the right for me if you can. So it sort of blasts off that layer, and again, this just helps sort of with skin texture, makes things pretty and smooth. Patients have often commented that their skin after a series of treatments almost looks airbrushed and they wear less foundation on the skin. We also use an evacuator because there's a little bit of carbon that we're blasting off the surface of the skin. And then to keep patients comfortable, we also go by with a little bit of cold air in order to make it really comfortable for patients during the treatment. This really isn't uncomfortable. The patient hasn't had any sort of numbing. And look straight ahead for me. It feels a little bit almost like sand pattering or a little bit of like pins and needles. The first pass is a little bit louder and a little bit spicier because we're taking off that carbon layer, but after that really you don't feel very much, and by using the cold air, you know, it really is a pretty comfortable procedure. Go ahead and turn to the left for me. Straight ahead. And now we're just doing the subsequent passes. So as you can notice, it's not quite as loud, not as much noise, not so much of that yellow light being shown, because now we're really just going after the inherent pigment if there's any sort of pigmentary disorders. This patient before treatment had quite a few brown patches on the forehead and on the cheeks. On the left side of the cheek there was a big patch. She'd gotten burned, you know, from an IPL, and that really is resolved. It's about 95% clear at this point. She looks really great. And we've really been maintaining her for quite some time. And it's just a nice, quick, easy treatment. It takes about 10 minutes to do. Go ahead and turn to your right for me. Endpoint as I'm treating the patient, go ahead and look straight ahead for me, is just a little bit of pinkness on the skin. You don't want to over-irritate skin, especially skin that's had melasma. I think if you over-excite those little skin pigment cells, that's when you get pigmentation occurring. So sort of a gentle endpoint that we use. And with Spectra, I typically see patients as a series of treatments. We do 12 treatments. Turn to your left for me. And it's a little more frequent than other laser technologies. So most laser technologies, we usually see patients with a frequency of about once a month. Since we're sort of gently, just very subtly taking away pigment over time with the Spectra, we usually see patients weekly over that course of 12. And then I start into maintenance treatment with the patient, and typically that's about once every 4 weeks, although it varies from patient to patient. Straight ahead, perfect. So that's Spectra treatment for melasma. If you have any questions, you can see us at artistskinmd.com.